Hello, my name is Elisa Diaz, and today I will be discussing one of the most pressing political challenges in Texas, which is abortion access, reproductive rights, and sexual education. This issue has taken center stage, particularly after the overturning of Roe v. Wade, which has led to increasingly restrictive abortion laws in Texas, including the 6-week ban. My presentation will cover the core challenges surrounding this topic and propose potential solutions to address these issues, with critical analysis using Alexander's question to explore how new information could potentially change my perspective. So, abortion access, reproductive rights, and sexual education are critical because they directly affect the health and well-being of women in Texas. Texas has some of the most restrictive abortion laws in the country, which has severely limited reproductive health care options. For example, the 6-week ban, often referred to as the heartbeat bill, it prohibits abortions after a fetal heart rate is detected, which is before many women even know they are pregnant, which is extremely crucial to know. These laws have led to significant increases in maternal health risks, including life-threatening complications due to delayed or denied care. The lack of comprehensive sexual education has also contributed to a high rates of unintended pregnancies and sexual transmitted infections. So there are three core challenges surrounding this issue. Number one being limited access to abortion services. The restrictive laws have forced many women to travel out of state to access abortion services, which creates not only financial but also logistical burdens. This not only is harmful but very unjust, as access to healthcare should not depend on where you live. And on your right, there's quotes, abortion is healthcare and abortion is a right. Number two being inadequate sexual education. Texas lacks comprehensive sexual education in schools, which has led to higher rates of STIs and unintended pregnancies. Young people aren't being given the tools that they need to make informed decisions about their sexual health, and it's extremely important. Number three, healthcare provider constraints. So doctors and healthcare providers are facing legal uncertainties when providing reproductive care. They worry that performing necessary medical procedures might lead to legal action, which can compromise patient health. So to address the challenges, I propose three solutions. Number one is reform abortion legislation to allow abortions up to 20 weeks, with exception for cases of rape, incest, and maternal health risks. So if you were raped, there was a situation of incest or any health risks after the 20 weeks, you're still allowed to have, that abortion. Number two is implement comprehensive sexual education. And so it is basically to include evidence-based sexual education programs in Texas schools. This will help reduce a lot of unintended pregnancies and promote informative choices. Number three, protect healthcare providers by establishing clear legal guidelines to ensure that they can provide necessary reproductive care without fear of prosecution. So here are potential criticisms and my responses. So one common criticism of my proposed solution is that loosening abortion restrictions might lead to higher abortion rates and undermine certain moral values. Many critics argue that allowing abortions up to 20 weeks could increase the number of abortions performed. However, research shows that access to comprehensive sexual education and reproductive health care actually reduces the number of unintended pregnancies and, by extension, abortions. The goal is to provide people with the education and resources that they need to make informed decisions, which ultimately lowers the demand for abortion. So Alexander's question, now, what information would it take to make me change my opinion? I am open to changing my stance if new, credible empirical data show that restrictive abortion laws in Texas have actually improved women's health outcomes or significantly reduced unintended pregnancies without negative consequences to maternal health. Additionally, if comprehensive sexual education programs were empirically proven to be ineffective in reducing unintended pregnancies and STIs in Texas, I would reconsider my advocacy for such programs. However, the current body of evidence strongly supports the benefits of accessible reproductive health care and comprehensive sexual education. Um, Therefore, it would require robust, peer-reviewed studies contradicting this data to shift my perspective. And here is my graph. To support my argument, this chart shows the unintended pregnancy rates in Texas compared to the national average. And as you can see, Texas has a higher rate of unintended pregnancies, which is partly due to the lack of comprehensive sexual education. This visual reinforces the need for better education and access of reproductive health care in Texas. And here's my works cited. And yeah, in conclusion, the issue of abortion access, reproductive rights, and sexual education is one of the most important political challenges Texas is facing today, in my opinion. The state restrictive laws are harming in women's health, and the lack of comprehensive education is contributing to high rates of unintended pregnancies. Thank you for listening, and that would be my presentation. Thank you.